Of his speech that, of course, has been released today and published by the ANC. He talks about the ANC admitting our shortcomings, accepting the criticism of people, and suggesting that the party is hard at work to correct its mistakes. He also talks about how the last 25 years have shown how complex it is for a country like South Africa to actually change. But he also says that the party has shown that, and the last 25 years have shown that South Africans are resilient and able to find ways to resolve their problems.
And earlier on, we also had President Cyril Ramaphosa driving the whole issue of a developmental state, saying that the NHI will be probably the first practical rollout of this, saying that it is unacceptable that access to health services is dependent on inequality, saying that the NHI must be enabled by legislation which will be finalized soon. He spoke about cross-subsidization of services. But Khaya Sithole, I'm just curious, so the NHI is the tool within which to achieve universal health coverage, and that's a very important distinction to raise. And then for me, then how do you work out the cross-subsidization?
Look, it's a difficult thing when we talk about the NHI, because the reality is that if one had to say, does universal health coverage exist in South Africa? Well, it does exist in some form, because all of us have got ability to access public hospitals. The question is, do we have universal access to quality public health care? And the answer is definitely not. And of course, one of the things underpinning the NHI is that, given the fact that you've got one system underpinned by quality and also, just superior resources being the private sector, and then you've got the public system which is really struggling to sort of match up to the private system, the NHI was supposed to then say perhaps there shouldn't be a distinction based on your economic profile when you're trying to access health services, and the NHI being the broad-based reform that is going to essentially enable all of us to participate in one system was the big idea that the ANC came up with. Now, of course, the key thing here is that if you then talk about the cost of funding the NHI, it's really going to be a question of those who can afford to pay more should be asked to pay more into the system, and those who cannot afford to pay into the system should not be prohibited from accessing the system. So, of course, it's really a matter of, if you look at the private healthcare system, it really has access to a lot of resources. So the medical aids and the private hospital groups obviously have got access to people who perhaps have got better economic prospects than other people. So the idea here is that you say, well, if you've got one system where the money seems to be, and you've got another system where the money needs to be, and yet it is in the system that the money needs to be, where perhaps the resources are not as good as they are, perhaps let us find a way to sort of create a pool of them putting things together.
Well, and that's a subsidization works because on. He did say that we're going to have a situation where the rich definitely fund the poor and the healthy fund the weak. So this is what President Cyril Ramaphosa had to say on this earlier on.
The introduction of the national health insurance will correct this injustice. We will finalize the enabling legislation for the NHI and make sure that everyone has access to quality health care regardless of their ability to pay. This is a revolutionary shift which requires that we promote social solidarity and work towards the cross-subsidization of services, where those who can afford to pay more to assist those who cannot pay, where the young subsidize the old, where the healthy subsidize the sick, where the rich subsidize the poor. This is the solidarity ethos that we want to promote in South Africa. We want to be a country where we should know, as citizens of this country, that we must all work together in solidarity with one another. And it is in the health sector where we want this to be played out. The national health insurance is going to be the one area where solidarity is demonstrated in real practice. The journey to universal health care has to start with deliberate efforts to address the immediate crisis in the public health system.
That is the ANC's President Cyril Ramaphosa.